Good seeing you, General O'Shaughnessy. I'm hoping everyone else can see you as well.
Okay, yes, I'm able to see the General.
Okay, great. So I'm John Quinelli. I'm the Deputy Director of Public Affairs here. And first of all, just thank you all for joining us. More importantly, on the line with us is General Terrence O'Shaughnessy. And he is the commander, as most of you know, of both NORAD and U.S. Northern Command. NORTHCOM, Northern Command, is leading DoD's operations here in the United States against COVID-19. And that's the reason we're here today, to tell you what we're doing and to take your questions. It's important to understand General O'Shaughnessy is not the base commander, okay? So questions specific to the base and installations, those go to somewhere else. General O'Shaughnessy is going to speak to the DoD, largely the DoD active duty efforts here in the United States, okay? This session is on the record. And please, we understand the importance of making sure that this local audience gets this, gets our message and gets our information. So we really do appreciate you joining us today. Finally, for all of you, if you need additional imagery, whether it be video and or stills, you can always go to the Divids Hub, DVIDSHUB.net. It's a great place to see some of the activities, especially a lot of the activities going on right now in New York City. And with that, we're going to turn it back over to General O'Shaughnessy to give you an update, and then we'll follow by a Q&A session. Over to you, General O'Shaughnessy.
Yeah, thanks, John. And let me first start thanking the team here for all the work that you've been doing to try to highlight what our team has been doing here at NORTHCOM and NORAD. What I want to start out with before we go to Q&A is really to highlight what this team has been doing at NORTHCOM and NORAD. Of course, we continue on with our unbelievably important mission of defending our homeland. That's a sacred responsibility that we know we have to maintain our ability to do. So both with our NORAD hat and our NORTHCOM hat on, we're maintaining our ability to defend our homeland. Some of the things that we've had to do is separate our team from the family. We're using Cheyenne Mountain. We're putting our teams in isolation to make sure that we maintain our ability to defend ourselves. Second big piece is the work that our team has been doing on the overall whole of nation response and the COVID-19 response that led by the White House Task Force, ultimately for our Commander-in-Chief. And he's declared a war on COVID-19, and we're treating this like a military campaign. And for the local audience, it's important to know the actions that this team has taken from right here in Colorado Springs is having a national level impact. And some of the support that we get from the local community is absolutely instrumental in our ability to do that national level response. And so I look forward to your questions, but I just want to ensure that this team knows that the headquarters here has been engaged for several months now in these efforts. We've been instrumental part of our whole nation response, and I want to make sure that we get that out to the local audience as well as the national audience. So let me turn it back to John for to open for Q&A.
Thank you, sir. So I'm going to start with a question that was sent in, and it was from AP Jim Anderson. And General O'Shaughnessy, he's asking for any updated information on military assets and units that are being sent to help with the COVID outbreak, plus anything on decisions about changing the mission of the two Navy hospital ships, the Comfort in New York or the Mercy in LA.
Let me start right here at home. The 627 from Fort Carson was called upon, and they've deployed out to Seattle. The intent was to build up a capability to meet the demand signal of the Seattle area, the Washington area, using a federal capability, in this case, the Department of Defense, to augment what the state and local capability was. This is actually a good news story. The 627th went out there literally in about a day and a half's notice, deployed out there, built a hospital. They were augmented by another unit to build up to a 250 is what we promised. We actually built out to about 284 person hospital for the governor and the state authorities. The good news is the Seattle, Washington area, based on the great work of the individual citizens to isolate themselves using the social distancing, has resulted in very little demand signal, and they were actually able to cover it with their own capability. And so we're in negotiations right now, or not negotiations, but discussions with the governor about potentially releasing that capability so we can use it on other national level areas that need our assistance. But this is a good news story, not a bad news story. And what I need to highlight there is our whole idea at Department of Defense, we want to be there before the need, right? If you wait until the hospitals are overwhelmed, then we're too late to be at that relief valve. And so by design, we are trying to deploy this capability across the nation before it's needed. And we see other areas where we're doing that. For example, we have a hospital team, but deployed to New Orleans, to Dallas. We have, of course, the Comfort and the Mercy deployed. We have multiple hospitals that have fallen in on the Javits Center in New York that has been well covered, as well as now capability going to New Jersey and Connecticut with more to follow. And so our approach is through the National Response Coordination Center is to take the prioritization that's being done at the federal level due to the demand signal at the state level and augment the state and local capability with our federal capability. And we've had an overwhelming response from the Navy, from the Army, from the Air Force, and the Marines to be able to respond to this call for assistance. The demand signal is not done yet, and we fully envision that we'll continue to deploy all over this nation the medical capability that is much needed at the state and local level.
Okay, I'm now going to turn it over to Tom Roeder with the Gazette for a question.
General, you talked about getting there ahead of the crisis, and that's something NORTHCOM has done successfully with hurricanes, putting resources in place weeks and months in advance to ensure you have what you need in the Gulf Coast. Sir, what have you done in this case? Your spin up earlier in the year was not apparent.
Well, actually, about a couple months ago, actually, when this originally started with the COVID-19, the president made an incredibly important decision to restrict the flights from China. One of the things they asked NORTHCOM to do was to be able to find facilities for our American citizens that needed to come home, but needed to be quarantined so as to not infect the local populations. And so we actually set up 4 different installations to be able to take on those initial Wuhan American citizens returning from Wuhan and take care of them. In addition, there was, if you remember that cruise ship from Japan, we were able to house some of those American citizens that came back from that. And then finally, we were asked, as we saw the Grand Princess off the coast of California, that needed a ability to take care of their citizens. We were the ones who were able to set up the housing and the quarantine for them for 14 days before they went back to their homes. And so we've been in this for quite some time, also trying to set up the command and control structure because, frankly, we didn't know where our help would be needed. So we set up a command and control structure with 4 2-star headquarters located, we call it a west area of operations, a center area of operations, a northeast area of operations, and a southeast area of operations. And we set up those commands in anticipation of the need well before they were actually asked to bring on the medical capability that was much needed. We continue to work with FEMA and trying to anticipate where the next need will be. And that part of the federal response is critically important, is that we have the White House Task Force working the whole of America approach. We have the NRCC, which is taking all the federal capability, prioritizing that and making sure it gets to the right spot. And that way the states know, just like we've done for hurricanes for so many years, they know exactly how to put their demand signal into the federal system. And we're a big part of that.
Okay. The next question is going to go to KCNC, CBS out of Denver. I believe that's going to be Connor McHugh.
Yeah, hi, General. Hope you can hear me all right. Thank you for your time. Today, CBS reported that the Comfort had started treating COVID patients, and the first worker had a positive test. First off, is that the case? And second, what are you guys doing to protect the people that are being sent around the country to help in these efforts?
So let me talk a little bit about the Comfort. The first thing you mentioned was the moving to taking COVID-19 patients. Our original plan, of course, was to go in there, be the relief valve of that high-end medical trauma, whether it be a motorcycle accident, a car accident, those that needed that high acuity care. And the Comfort is well suited for that with the operating rooms, the intensive care units, the surgeons, the medical team that staffs it to cover those high-end events. What we found actually was that based on everyone being at home and isolating and staying at home with the social distancing, is that demand signal for that high-end trauma was actually way down. And so as always, no plan survives contact with the enemy. In this case, the enemy being the COVID-19 virus, we needed to adjust our plan, and we realized that fairly quickly. One of the things that drove us to that is as we took patients in, they had been screened, they had been checked appropriately, yet they ultimately ended up being COVID-19 positive. Fortunately, we had the right medical protocols in play, and so we were able to handle the immediate medical attention they needed while still protecting our force. They were provided the appropriate medical care, and then they were transferred over to the Javits Center for the COVID-19 treatment. What we found, though, when we did this is based on the demand signal, we really needed to adjust fire even more. And so in coordination with both the governor's office and the mayor's office, we reconfigured the ship to be able to take COVID-19 patients. And so we have what we call green areas and red areas. The green areas are the areas where we keep our crew, keep folks that are not doing the medical treatment, and keep them clean of the COVID-19 virus environment. And then we have other areas that are set up to be able to operate with the COVID-19 because we don't know with the patients coming in whether they do or do not have the virus, and we need to give them medical attention. And so that separation of both of those, as well as building some additional facilities outside the ship with some tents that we're able to do the in-processing, has really allowed us to transition. We'll take any medical emergency, whether it's COVID-19 positive or not, and focusing on still that high-end trauma, emergency care, the urgent care, and using the Javits Center for the traditional COVID-19 patients. But that full spectrum of capabilities has proven to be really valuable, and that's the concept that we've worked with the local authorities, and it's very well received. When we turn now to the question relative to the positive crew member, first, to be clear, that crew member is isolated. That crew member has had no, it's not a medical personnel, it's actually one of the crew for the ship. And that person has had no interaction with patients. We're, of course, taking care of that crew member in isolation, and will be provided the appropriate medical care. But there's no impact to our operations, either to the ship operations or to the patient operations, and we'll continue on without missing a beat.
Okay, the next question goes to KUNC, NPR out of Northern Colorado, Michael De Ioanna.
General, thanks for taking the time to talk to us this afternoon. My question is, you call this a war, and war means being prepared for many different scenarios. So you're looking at the different scenarios. Can you tell me when?
Hey, Michael.
Yeah.
Hey, Michael. Michael, we're not hearing you, I don't believe.
Yeah, I can't hear the question.
Yeah.
There's distortion.
Can you hear me now?
No, Michael, you're not coming through. Hey, if you want to try to fix it, we'll move on to the next person, and we'll come back to you, Michael, okay?
Okay.
Okay. KRDO, ABC, here out of the Springs. Chase,
yes, thank you, General. We're trying to take a local look here in El Paso County and Colorado Springs. We were just wondering, just in response to this, what kind of changes have we had to make in kind of the Colorado Springs and El Paso County area, just in regards to COVID-19 and just this pandemic here?
One of the things that's different about our response to this request for assistance is we're right in the middle of it. And so whilst we're used to maybe providing assistance for a hurricane ravaged area, maybe a couple of states were impacted, this is impacting our whole nation, and Colorado is not exempt from this. And so while we continue to provide national level assistance, we also have to maintain our ability to operate here in Colorado. So we have taken some actions to ensure our ability to do that. A couple of things we've done is within the headquarters, we've applied a social distancing in the headquarters itself. So we are maintaining separation. We've actually used a couple extra buildings that we didn't use before to disperse our force. We've actually put some crews in isolation. We moved up the Cheyenne Mountain and are using the space up there. We have ensured our ability to continue these operations even while amongst the virus that is clearly amongst us here in Colorado Springs. So a very different mindset, one where we're normally bringing the fight, bringing capability to other locations. Now we're having to fight through it right here at home. And the other part is we have to take care of our families. And all of us have loved ones, all of us have families. We want to make sure that we're taking care of our military families and those that support us. At the same time, we're able to carry on with this mission. So very different dynamic. I think we have the right procedures in place. We have the right ability to maintain our assurance for the operations, but it's very, very different. And I also would just talk about the tremendous support that we always get from the Colorado Springs and the local community here. And that continues in this environment, just like it has for every other mission that we've done here. Can't say enough about the local population, Colorado Springs, the support that we get, and how important that is to support our families and to support those members who are very much involved in this national level fight.
Okay, the next question is going to go to KKTV, CBS out of the Springs, and Spencer Wilson. Spencer, are you still on the line? Okay, we'll go to Fox 21 News right now. Krista Widiak, are you on the line?
It's actually me, Carly Moore. Okay. But yes, kind of in that same vein, you know, we're out of Colorado Springs. So just obviously, I don't know if you can speak to how many, you know, from, you know, Peterson, these are our families like you were talking about. You know, you've kind of already answered what's being done to protect those serving. Is there any way that civilians here at home can help? I know, like you said, this community is always willing to help out. So is there anything that we can do to help, or just continue to support? And how are our service members at home being protected?
First, I would just really talk about the family members themselves and what they're going through. And in many ways, we have a mission that is like some of the local providers, whether it be the police, the firemen, the health providers, where we have a mission that doesn't stop because we have this COVID-19 situation. The support that we get from the local community to do that has been absolutely outstanding. And the national level impact that this team is having here within the headquarters of the NORTHCOM and NORAD team here has been having an unbelievably big impact across our nation. And it's only doable because of the support we have right here in Colorado Springs. My message to the local team here and our great citizens of Colorado Springs is really listen to the guidance from our leadership. It is incredibly important. We have certainly seen that when the social distancing is applied, when people that can stay at home, the impact to the curve, to flatten that curve, if you will, is really being demonstrated in cities like Seattle and certainly in New York and what we're seeing now. And so all of those social distancing things that we're doing, whilst at the same time keeping the food supply open, keeping the public services open, all of that balance between both of those is incredibly important. And we always feel, and we certainly feel now, that the support that we get from the local community is absolutely outstanding and unmatched anywhere in the world.
Thank you, Jim.
I wanted to jump in real fast. I'm sorry, this is Spencer from KKTV. Are you able to hear me now, or?
Yes, I can hear you now.
Okay, I apologize. Can I jump in with my question really fast?
Yeah, absolutely, Spencer. Go ahead.
Sorry about that. All right, so General, I was going to ask, I know we have some people heading up towards New York. Is there any plans that you've had coming down the line in terms of trying to alleviate hospital help down in Colorado, or is it just basically we're going wherever the greatest need is?
So we take our priorities from the National Response Coordination Center. That is led by the FEMA Administrator, Pete Gaynor. And we're tied in with them as they look at the predictive analysis of trying to determine where is the need going to be in the future. I will say Colorado is part of that discussion. What I mean by that is the demand signal that we are hearing from some of the local hospital system here has made it to the national level. And that as we look at the impending cases and the rising cases here in the state of Colorado, we are hearing that at the national level. It's not getting a mission assignment yet from FEMA and the National Response Coordination Center yet relative to Colorado. We do know that it is an area of concern. If we were given that responsibility, it would be amazing to be able to provide assistance to the very community that has been providing such great care and support for our team.
Okay. Channel 5, Allison Zimmerman. Are you on the line?
I am.
Your question.
Can you can hear me good?
I can.
All right. Hi, General. Again, thank you so much for your time here. So you're obviously sending people to these very high impact areas. what percentage of your servicemen and women do you anticipate contracting the virus? And at what point are you guys anticipating possibly having a need for involuntary recall of medical personnel from inactive reserves?
So right now, we've been very fortunate to have an incredible amount of volunteerism for some of our reserve and our guard members, and we've been able to apply them at the national level. In fact, the teams that are deploying right now in New York City are primarily based from the reserve and guard force. I'll use an example of we took 325 individual volunteers from both the Air Force and the Navy reserves. And as they were called up, they have now been deployed to 11 different hospitals in Queens, in Manhattan, in Brooklyn, in the Bronx, and they're providing that much needed relief. And to the earlier point that you made, part of this is because of the New York City healthcare system is taking some losses in the sense of some members of the team are down now for the COVID virus and are recovering themselves. And so that has opened up a demand signal to bring in doctors, nurses, technicians to support the hospital. So our members, 325 of them in this case, are actually falling in on those hospitals to augment the teams that are there. Of course, we're giving our team the training, the equipment, the personal protection equipment to ensure that their safety, but clearly they are at risk, and we understand that. They understand that, and that's part of their commitment to their nation is to go to the sound of gunfire, if you will, and run there to support the nation when the nation needs them. So it is not without risk. We fully understand that. They fully understand that. But at the same time, we're setting them up for success by giving them everything they need to be successful.
Okay. KPOF AM 91, Denise Washington Blomberg, your question.
Thank you, General. Appreciate your time. I'm curious, who has jurisdiction in a situation in terms of hospitals vying for medical staff and for equipment? Would that be federal? Who really has jurisdiction? Since NORAD is federal, FEMA is federal, would that trump any local any local needs or any local decisions? Is that inevitably, would that be yours or FEMA's decision?
So NORTHCOM and NORAD are part of the federal response. Clearly, there's heroic work being done at the state and local level, but at some time they exceed in many cases their capability and capacity, and that's where we come in as a federal response. And so everything that we work is being done through the White House Task Force and ultimately the National Response Coordination Center led by FEMA. And so the governors, they put a demand signal on FEMA. FEMA then decides who has the best capability to respond to that. We make what's available from the Department of Defense known to FEMA, and then FEMA would give us a mission assignment, is how they call it. And when we get that mission assignment, we look at all the forces we have and determine which of those forces that we've been given would be best applied to that problem. So it's a little bit of both. FEMA gives us the mission assignment and the prioritization of where we're going to put the team. We at NORTHCOM and NORAD, and specifically in this case NORTHCOM, look at the forces we have available, the forces that the Department of Defense has generated, and we determine which force goes where.
You're always, I need to follow up. You're always on the ground though, correct? With medical staff in a situation like this. For instance, you're in New York, you were just talking about 325 of your personnel going in to help those who had fallen. So in a situation like that, I don't know, I'm just visualizing FEMA going in or NORAD, NORTHCOM going in. Do you take jurisdiction then from whoever is the local hospital administration? I'm trying to figure out who gets to be boss.
Right. No, I understand your question. What we try to do at NORTHCOM, and really in coordination with FEMA, is we are looking to try to insert ourselves into the state and local healthcare systems. And so I'll use an example. When we bring the comfort in, we don't want to operate the comfort independently. We want to operate the comfort in coordination with the city and the state. And so we tie right into their healthcare system. For example, in New York City, we're in daily coordination with Deanna Criswell, who is actually a former guardsman from Colorado that is the commissioner for their emergency management. And we tie right into them. And so they look at it, there's a demand, there's say an ambulance that picks up a patient. They are then tasked from the city to go to one of many hospitals, of which the Comfort is just one of them. And so what we do is we don't try to run their system for them. What we do is we try to augment their system for them. And that's the best way to really support the state and local governments, as opposed to trying to come in and be unfamiliar with the system and try to take it over. So we're definitely tying into their system and take advantage of the local expertise and just bringing additional capability and capacity to that system.
Thank you, General.
So let me go back. Michael, Diana, can you hear us? More importantly, let's see if we can hear you any better.
Yeah, I can hear you. Can you hear me better now?
Yeah, absolutely.
Okay, great. Thanks for taking my question again. General, war means being prepared. You've called this a war. That means being prepared for many different kinds of scenarios. I'm sure you've looked at many different kinds of scenarios. Do you have any idea when this war will be over? And how will you know?
Well, we're definitely treating this as a large military campaign, and it starts right with our commander-in-chief, and he's declared war on COVID-19, and that's exactly how we're treating it. We have planned for these events. We have done a lot of preparation to understand how we can best respond to this at the national level. We are certainly proud to be part of the whole of America approach. What I do know relative to the timelines is that this is going to be a difficult time. It is unpredictable whether we're going to measure this in days, weeks, months. But what I do know is that we're going to be part of the response to our nation as long as they need us. What I will tell you is that the discussions that happen at the White House task force, led by the Vice President, of which we are often included in those, they are looking at this as a whole of America with public-private partnerships, with an understanding of the economy as part of this, and an understanding that the longer that we stay in isolation, or the longer we do the social distancing, the better we're going to be from the health aspect, but we understand the balance of the whole of nation and the economy aspect of that. And so all those discussions are happening at the right level. They're happening with our senior leadership as a nation, as well as our local governors, very much part of that. There's been numerous events where the White House task force meeting, it has all of the governors calling into it. So this literally is a whole of America approach. The timelines are really hard to predict at this point, but what I do know is that NORTHCOM and NORAD will be part of this until we prevail on the other side.
Do you have a best case or a worst case scenario that you can share?
Well, my sense is that this week coming up and next week are going to be very difficult and challenging. We see peaks in a couple of key areas, specifically in the Northeast. We see in the following weeks after that, we are starting to see indications of peaks in other cities. And I think that's the kind of the pattern that we'll probably flow to, is that we'll have individual peaks in different cities, different locales that we'll have to address as this continues on for the next several months.
Yeah, just one quick other follow-up question. Some states are not implementing stay-at-home orders yet. I think there's about 6 or 7 of them. Does that complicate fighting the virus from your perspective?
I think one thing that we found is that the stay-at-home declarations, the social distancing taken seriously, they have a very significant impact. Now, every community is different, every state is different, every local area is different. And so it's hard to apply a national level direction to that. And so I do think listening to the local authorities is the right thing to do. I think they have their finger on the pulse and they're making the appropriate decisions. But I say there is no doubt that the social distancing, the activities that our government has taken with respect to the direction to stay at home has had a significant impact in the peak of this. And I think it's no question, it is saving thousands and thousands of lives.
So, can I get in for a moment?
Hey,
I'd like to follow up on his question. Would that be okay?
No, we're not going to be able to. We're getting to the end of our time, okay? And so I'm turning it back over to the commander for some final comments. Over to you, General O'Shaughnessy.
Well, what I'd like to say, first, all of you, thank you very much for allowing us to highlight some of the amazing things that our team is doing here. I'd certainly like to say from the local population within the Colorado Springs area, the support that we get is always outstanding. This is no difference here. And it really does matter because we're having a national level impact with the NORTHCOM team here. Not only are we supporting New York that you see with the great activity going there to support a very difficult situation. I think you're going to see us continue to do that all over this great nation. We are ready to respond, and the only reason that we're able to be ready to respond is because of the great support that we get from this community. So I thank you all very much. I appreciate the support of all of the local community, and then I also want to thank the families of the members of NORTHCOM because our team has been working incredibly hard. The sacrifices the family are making with some separation is extreme, but it's all for an incredibly important cause. And I thank the local community, I thank the families, and I thank the members of our NORTHCOM and NORAD teams.
Okay, everyone, this concludes today's conference call. If you have any additional questions, give us a call here in the Public Affairs Office, and we'll try to get you guys responses as soon as possible. Thank you, and this is NORTHCOM out.
Thank you.
Thank you.
Thank you.
Yeah.